Biofeedback Therapy Case Study by Alexandria Nixon. Client is a 26-year-old female who identifies as heterosexual and cisgender. Client is of Native American descent. She is currently working approximately 30 hours a week as a nighttime data reporter from home. She's currently enrolled in college full-time in med school and is completing an internship at a local hospital. She reports to be engaged and has been in a relationship for 5 years. She also lives with her fiance and has for the past 4 years. Client has no children. Client reports believing in a higher power in the afterlife but is not affiliated with any religious belief. Her hobbies include reading, writing in prompt journals, painting, drawing, playing with her dogs, and binge watching Hulu and Netflix in her spare time. Client reports the following physical medical diagnoses: chronic pain, type 1 diabetes, psoriasis, migraines, and chronic nausea. Client reports the following mental health diagnoses: major depressive disorder, which was changed to dysthymic disorder in 2019, generalized anxiety disorder, post-traumatic stress disorder, panic disorder, and general insomnia disorder. Family history. Client reports that she does not have a relationship with her family other than her grandparents. Client reported that she has little contact with her father and has never had a relationship with him. Known medical and mental health history of father includes substance use disorder, abuses alcohol, childhood epilepsy, brain aneurysm, and history in the family of cancer, type 2 diabetes, and heart disease. No known mental health illnesses were reported. On her mother's side, her mother passed away in 2015. Mother's medical mental history includes multiple back surgeries due to spinal stenosis and degenerative disc disease, primary biliary cholangitis, which affected the liver. Mental health history includes major depressive disorder with a suicide attempt in 2011 and general insomnia disorder as well. Client attributed PTSD, panic disorder, and increased insomnia to the unexpected death of her mother and said her symptoms worsened when her mother died. Other history of medical and mental illnesses from maternal side include heart disease, degenerative disc disease, type 2 diabetes, Alzheimer's, generalized anxiety disorder, substance use disorder, and schizophrenia. Client reports that she believes her medical ailments are being managed and are currently under control. Client reported a slew of medications for physical health problems, including for the treatment of her type 1 diabetes, chronic pain, chronic nausea, and migraines. Client reported that her mental health is currently being managed, but that she continues to struggle the most with chronic insomnia. Client reports medication she utilizes daily for her mental health illnesses include an antidepressant, an antihistamine for panic attacks and or increased anxiety, a hypnotic for insomnia in conjunction with diphenhydramine or Benadryl in trying to treat the insomnia. Client was self-referred in order to find alternatives or to use in combination with medication to treat chronic insomnia. She reported that she has been on 7 different medications since her diagnosis for treatment of insomnia and still struggles to fall asleep as well as stay asleep. Client reported an adverse reaction to Ambien and requested the discontinue of usage of it. Client reported that Ambien was actually the most effective in the treatment of her insomnia, but she now refuses to take it again despite the doctor recommending continued use of it after discontinued use of Xanax in combination with the medication. Client reported that she believes her other mental illnesses are well managed currently, but chronic insomnia has worsened for her over the years and is beginning to cause more functional impairment. Client reported to feeling exhausted but is unable to fall asleep and stay asleep despite the hours awake. She reported that she does not ingest caffeine as it increases her heart rate and causes increased anxiety, stress, and panic attacks. She reported that her migraines occurred due to inability to get adequate sleep and that there was a pattern when she was unable to get adequate sleep. Her migraines did return on a regular basis. Client reports regular irritability due to lack of sleep. Client reported an increased worry that her relationship is being negatively affected by her constant daytime tiredness and behavioral changes attributed to lack of sleep. Client reported that her insomnia has worsened over the last few years, around the time of the year 2017. Client reported that she had problems falling asleep as a child since around the age of 10, but medication was not needed until the death of her mother. Client reports a history of marijuana usage in 2015 for insomnia and anxiety, but quit usage in 2016. She did report that marijuana was effective in the treatment of insomnia. Client reports that some nights she is able to fall asleep within an hour, but majority of nights it takes an average of 3 to 4. She reports that taking her hypnotic and diphenhydramine together around 10:30, but on average does not fall asleep until 1 to 2 a.m. Client reports that she must fall asleep to noise of some sort and will play Netflix on her phone with the screen off in order to fall asleep. Client reports to waking up approximately 2 to 3 times over the course of sleep and has a hard time falling back asleep once she's awoken. External factors. Client believes that insomnia worsens when she has a lot on her mind and plate. Client's strengths reported and observed include that she is willing to seek treatment for her insomnia. And while she admits to trying very little biofeedback or alternative techniques other than medication, client has tried an array of medication for the problem and regularly consults with her doctor regarding the issue. Client is open to alternative techniques, including biofeedback therapy. Client is compliant in recommendations given to her regarding her mental and physical health. Her barriers include that she is not willing to try techniques with discontinued use of medication. While client reports that anxiety is under control, it is suspected that chronic insomnia may be a secondary factor to her generalized anxiety disorder and that the two are somehow connected. Client's ideal outcome. She is looking for biofeedback techniques that would allow her to fall asleep faster and stay asleep. The client hopes to have a shorter period of laying in bed and going to sleep, since it takes 3 to 4 hours for the client to fall asleep. The client reported that she would be happy if it took an hour or less. Client hopes to be able to stay asleep. She wakes up 2 to 3 times per night and is awake for up to an additional hour upon waking. She said she would like to cut that down to under 10 minutes. Client is hopeful for a total of 8 to 9 hours of sleep total. She hopes that alleviation of chronic insomnia will further help her migraine episodes decrease over time, as well as any behavioral problems that she believes has contributed to the insomnia. Treatment options given. These biofeedback techniques are aimed at reducing symptoms of chronic insomnia and were given to the client. Weighted blankets, weighted sleep masks, relaxation therapy, adopting a routine at bedtime, blue lights, use of diffuser in bedroom in combination with lavender essential oils, chamomile tea, taking a warm bath, shower before bed, progressive muscle relaxation technique, acupuncture therapy or pressure point therapy, blackout curtains, white noise, use of earplugs. Some of these I gave to the client because they had a dual aim at reducing not only chronic insomnia but also reducing anxiety. Those include the relaxation therapy, chamomile tea, warm bath, progressive muscle relaxation, and pressure point therapy. I gave all of these options to the client. She was willing to do the majority of them. She picked which ones she was able to do, which ones she had the means for, and tried them out. Client reported an increase in falling asleep faster when utilizing different breathing and relaxation techniques. Client also noted a difference when implementing progressive muscle relaxation therapy, which progressive muscle relaxation therapy includes going one by one at a time as slow as possible, slowly releasing your muscles in order to get them to relax better, overall increasing your chance of relaxing better. Client reported little difference with blue light and diffuser, but cannot rule out the benefits. Client did report that she did not utilize the blue light, nor did she utilize the diffuser on a regular basis. She did say that the lavender oil was okay, but it did irritate her nose, so she wasn't able to use the lavender oil as much, but she did use the blue light more, she said, and the blue light also distracted her from actually falling asleep after a few days, and so she did discontinue that. Client reported that the weighted blanket has also helped recently in what she believes is staying asleep. She said that she also implemented the use of 3 fans in her bedroom because the weighted blanket did make her more hot at night, and she does get agitated when she is warmer at night, and further making it harder for her to fall asleep. And so the utilization of 3 fans helped her. She's no longer warm at night, and that weighted blanket, she believed, has helped her fall asleep faster, stay asleep. It also has helped her anxiety. She said she's actually using the weighted blanket now to calm herself whenever she feels an increase in anxiety and stress. Client also reported that she purchased a weighted sleep mask, and that the weighted sleep mask has also helped. She said sometimes it does hurt her eyes, so she has not used it every night, but it does block out light really well and does make her feel sleepier faster. Client was also able to discontinue the use of falling asleep to Netflix. She reported that she started using the Calm app on her iPhone for noise, and that thunderstorm sounds help her fall asleep better. She did report that when it rains or it thunderstorms, that she is able to fall asleep faster to the rain, and that she has a better night's sleep when it is storming. And so the use of having a simulated sound of thunderstorms on her phone has also helped.